Hello. How are you doing, Sabina? Are you able to hear me?
Yes, ma'am. I'm good and I can hear you very good.
All
Yeah.
right. Okay. Perfect. Yeah. How are you doing, Sabina?
I'm fine. Ma'am, how are you today?
I'm fine. I'm all right. Thank you so much.
Okay, so this is ma'am from UK, Dr. Neeta Chandani. Ma'am, will you share with us your journey from India to UK along with your BHMS journey with us?
Yeah, definitely. Yeah. I did my BHMS from Lokmanya Homeopathic Foundation's Homeopathic Medical College in Chinchwad, which is affiliated to Pune University. And I graduated from at my BHMS in 1994, and then we had our internship. We had a lovely faculty who literally drilled everything into our brains. We had lovely faculty with regards to medicine, gynec. We had a lovely orthopedic teacher as well, with surgery, forensic medicine, and homeopathic faculty was amazing. Dr. Varame, Dr. Bagari, they taught us organon, and teachers for materia medica like Dr. Modi. They were excellent teachers. I'm really grateful to all of them. And after I graduated, I did my internship. And while doing the internship, I did my housemanship as well in a private hospital at Dr. Devdhar's hospital, which was again a gift for me, kind of. And he taught us everything, how to examine a patient clinically, and how to diagnose everything. And he was a thorough clinician. He is rather, and he taught us a lot. And first and foremost, I'm grateful to my parents for wherever we are today. We are because of the blessings of our parents. I'm grateful to my mom and dad. Yeah. And yeah, my brother is also a homeopath. He's practicing in Pune. He's an excellent homeopath, doing very well with his practice. And my sister is an orthodontist. She is doing her practice. And I have a younger brother who is an engineer, but at the moment he's doing his own business. And then after 1995, when I finished my internship, I did start my practice in Pune, where I practiced for almost 2 years. And then I got married, and I got married in Mumbai. I got married to a homeopath, Dr. Manish Khubchandani, and we started our practice together. And we had almost 3 clinics together. We used to run them. And then later on, he decided to do his physiotherapy. And then he also pursued his post-graduation in physiotherapy in at Oxford Brookes University. He did his post-graduation in neurorehabilitation. And he has been a great support in my life. When I started practice in Mumbai, he did support me a lot. And the same here, when I reached UK, he did help me in every way. So I got myself registered with the Alliance of Registered Homeopaths. And then I started my practice here in the UK, and by God's grace, yeah, I'm doing a good practice at the moment.
Yeah, and you were telling me that since 25 years you have been practicing and you have seen thousands and cases of these female cases,
Yes, yes,
all
I've been,
the female troubles,
yeah, I've
and
been
many
practicing.
other cases,
Yeah, I've
and
been
many
practicing.
more cases. So that's a good privilege for me to have met you and found you and
Thank
learn
you.
something from you.
Thank you so much. Yeah, I have been practicing since last 25 years. And I got into this more of female cases. For that, I would say I am grateful to my mother-in-law, who was a homeopath as well. And she had a clinic in Mumbai, and she had loads and loads of patients. She was basically more of seeing more of gynec patients. So I did get to learn a lot from her. And yeah, and so we had lots of gynec patients. Kind of, we had patients with infertility, with polycystic ovarian disease, fibroids, menstrual irregularities, dysmenorrhea, and the list goes endless. Like menopausal patients as well. Yeah.
Yes, ma'am. So today, for that reason, we have decided to discuss the female health problem cases
Yeah.
in our live session. And I'm honored to have you over here with me
Thank you.
because you have a good experience in all these kind of cases. And even in UK, you are having a very good response and you have a good patient follow-up from the cases that you're watching. So since female troubles is a vast to say field, so we will try to discuss the more prevalent and more diseases which are nowadays prevalent and more common to people, which will be understood by the patients also,
Yeah.
as well as the homeopaths or the budding homeopaths will get inspiration from your cases,
Yeah.
your case studies. So we'll start with the very onset, the milestone in a woman's life is the menstruation, the menstrual cycle.
Yeah.
And from the very onset of this menstruation, they get this pain that we call dysmenorrhea, the menstrual pain, which everyone uh, feels and has to pass through this phase,
Yeah.
which could be primary or secondary. So this primary dysmenorrhea is the regular menstrual cramps and pains, which are sometimes tolerable and sometimes intolerable, for which the patient has to take some or the other medicine.
Yeah.
And the secondary dysmenorrhea, which occurs due to some underlying pathology, which could be any disease, endometriosis, fibroids, PID, etc. So, ma'am, tell us about your dysmenorrhea case that you have treated with much success.
I would like to talk about a classical case of dysmenorrhea where the female was only 16 years of age and she had severe pain in abdomen wherein she was completely disabled. She could not attend her college. She couldn't do anything. She had to lie down all day kind of. It was almost for 2 days and third day it would reduce. So it was going on since her menarche, and she was in really great trouble and couldn't go without painkillers. So usually what I do is I go with the classical method. So I take a complete history of the patient and then decide on the medicine. So I did take her complete physical generals, her mentals and everything, all the details. So after that, I arrived to a remedy which turned out to be lachesis, and I gave her 1 dose of lachesis. And in my practice, I also usually dispense biochemic medicines. I am a great follower of biochemic medicines, and this was introduced to me by my father-in-law. So I'm really grateful to him for that. And in this case, I gave the remedy MacFos 12X, which we continued for almost 3 months. It was one tablet 3 times a day. And lachesis, I gave 1 dose every month. That's all. And after 3 months, the patient never complained of dysmenorrhea. So that was a constitutional remedy, of course. So it will differ from case to case. But basically, the MacFos part will remain the same.
Okay, that's a nice case. And even in Organon of Medicine, Master Hahnemann, almost 300 years ago, he has discussed about the female case taking, the details of female case taking, especially during the menstrual period, before, during, and after. He has given a detailed information about how to take the case, how to ask about the discharges, the menstrual discharges, the onset, the menarche, the symptoms, the character of the blood, and also the character of leukorrhea, and he has given great importance to the to the mental symptoms, the mental affections, and the mental state of the woman or the lady during that time, before,
Yes.
during, and after. And he says that these symptoms should be as a general symptoms which should be kept in mind to be asked during these case taking. So this, which is now being considered in many researches, that the menstrual symptoms and the effect of the estrogen, progesterone, and other hormones have an effect on the emotional being of the person, of the woman. So, it's a great guidelines for us to follow in the hormone. After this painful menstruation and dysmenorrhea, the the second thing is irregular menstruation or abnormal bleeding. Like it could be in the form of less flow, it could be in the form of more flow.
Hello. Yeah.
It could be intermittent flow. This
Yeah.
is the three types of flow mainly, which could be like oligomenorrhea, polymenorrhea, and of course these are these are due to many causes, many underlying causes like fibroids, polyps, PIDs, pelvic inflammatory disease, any sort of infection. It could be due to hypothyroidism. It could be due to complications of pregnancy, cirrhosis of liver, etc. So whatever may be the underlying cause of the disease, these irregular menstruational bleeding is one way or the other related to infertility also, besides other symptoms. So ma'am, you tell us your case. You said you have good cases in infertility as well as PCOD, as well as fibroids. So please share
Yes,
with us the
absolutely.
cases.
Yeah. All right. So I start with a case of oligomenorrhea, where the patient complained of very scanty menses. She would hardly see some blood, and there was a few stains. That's all. She never wanted to use a pad as well. So no sanitary napkin. So she had come to me basically for not being able to conceive. She was married since almost 3 years, and they had never used contraceptives, and they were trying to conceive, but they couldn't. So on taking the history, I realized that she was suffering from oligomenorrhea, wherein we started, I took the detailed case history, and then accordingly I reached to a remedy, which came out to be Calcarea phos. I gave her the remedy, and along with that, again, as I mentioned, I do give biochemic medicines. I gave her biocombination number 15 3 times a day, along with Calcarea phos, and then we continued the treatment. And in almost 3 months' time, she started getting better periods, and her bleeding went on from a few drops to a day, and then to 2 days, and to almost 2.5 days she reached. And then I asked her to try and conceive. Now what I do is give them the dates which are good for fertility, and that is the ovulation days usually. So they tried, and then she got pregnant in almost 7 months of treatment. And this was regarding the oligomenorrhea. I'll describe just one case of everything, because we can't go on and on. So with polycystic ovarian disease, I had a lady who was suffering from polycystic ovarian disease. She had the diagnosis, she had done her sonography. Yeah, she was suffering from irregular menses and delayed menses. Her bleeding was okay, but then the menses were always delayed, and she had dark clotted blood all the time. And on taking her history, we came to the remedy of Crotalhor, where I gave her Crotalhor. And then along with that, I did give her biocombination from, I would mention one thing over here. I refer to a book called B.S. Darbari, which is a really great book. It is written by a non-homeopath, but it is an excellent book to refer. So I usually use biocombinations from there. And then it was almost, I think it took almost a year for her polycystic ovarian disease to improve. Her menses came back to normal, and she started bleeding like fresh red blood. And then almost in a year or so, they conceived. Yeah. Yeah. And then that was
any other case of PCOD or fibroid?
Yeah, fibroid. I'll tell you about fibroid. There was a lady with, I have the reports as well. Yeah, she had almost a 2.8 centimeter fibroid. wherein she had a few miscarriages. It was a kind of secondary infertility, I should say, not primary. So she did conceive, but then she had miscarriages. Yeah. And then in that case, we took the history and like a complete, like a classical case, I usually take the mental generals, as I told you. And then we reached the remedy pulsatilla according to her mindset and everything, physical generals, including everything. So we gave her pulsatilla, and gradually I had to increase the potency. And then along with that, I also gave her the biocombination and the mother tinctures to be prescribed in fibroids, where I usually give Thalaspi bursa and Fraxinus americanus. So after that, we got the sonography done in 3 months, where the fibroid had reduced in size to almost 1.6 centimeters. And then after 3 months, we again did the sonography, where there was a fibroid which was of a very small size. And later on, she could get pregnant in 6 months after the treatment or so.
There is a Kohli Manmeet Kaur saying, Geeta ma'am is a superwoman and her treatment cured my piles and kids' allergy problem was also cured.
Thank you so much, Manmeet ji. Yeah. Yeah, okay.
Also said hypothyroidism cases. You have been treating many hypothyroidism cases.
Yes, yes.
Although it's a hormonal disorder, not directly, but it does has many metabolic effects on all the hormonal as well as metabolic functions of the body, and also it's a reason of infertility.
Yeah.
So, ma'am, would you like to share some cases of hypothyroidism?
Yeah, in cases of hypothyroidism, whenever there were a few cases wherein the patients directly come to homeopathy, but mostly it is that they are already on eltroxin or thyroxin, and they come to us saying that we are not able to take these medicines now for long, and we are getting some you can say some symptoms like hair fall or laziness or something like that. And then they would want to go for some alternative therapy. So in that case, you cannot just immediately stop any medicine, because we would always see what is good for the patient. So we usually continue that medicine. We take the history, we start the constitutional treatment, and thereafter every 2 months, I get the test done to check the results. And as and when the T3, T4 goes down, we gradually reduce the dose of thyroxine or eltroxin, and then we further go with the treatment. And like gradually after reducing, then we can stop it. And in that, since it is a metabolic disorder, diet plays a very important role, where I do give dietary advice as well. And there are certain smoothies which are to be taken. They are really helpful, and I advise patients to take those. And I am a great advocate of yoga as well, where I advise patients to do yoga along with all this medicines and diet and everything. So it is a complete package, you can say, where it's diet, it's yoga, it's the smoothies, and it's the homeopathic medicines. So that reduces the levels and gets back to normal, gets the thyroid levels back to normal without any other medicine. So there are many patients who have been free.
You advise yoga as well as dietary advice, and also something else you were telling me about that.
The smoothies.
Yeah. Also, the lifestyle changes.
Lifestyle changes, of course. Yeah. Lifestyle changes are important, are necessary for any metabolic disorder. So that covers the diet and how much you exercise every day. That is important. You need to move.
Which is one case that you have got much improvement, and think that case of yours was very wonderful with the prognosis? Any case
Sorry.
that is very close to your heart? You were discussing
Yeah.
like you have seen thousands of cases. So is there any case that has shown remarkable improvement?
That is one case which I would like to say talk about. This was a female. It was almost 9 years after her marriage that she couldn't conceive, and they had tried almost everything. They had 3 failed IVFs as well. So she was like, now what should I do after this? So she had come to me to seek homeopathy. And then we started the treatment as per her constitutional. We had to give her cilicia and we started the medicine. And say after 9 months or so, she conceived naturally, which was really surprising for me as well. So I can never forget that case. That is something really interesting and something to be something close to my heart.
Yeah, this is the magic of homeopathy.
Yeah,
If
this is the
people
magic.
still
Yeah.
understand and rely on it.
Yeah.
So the simple medicines can work wonders for the patient
Yes,
if
they
they
do.
have the faith and trust on homeopathy.
Yes, they
So
do.
they
They
can
do.
avoid all those big terrible methods and they can just go for simple medicines, simple and soothing medicines, and can have remarkable changes. And
Yeah.
infertility is solved to quite a good extent, and there are many, many cases where infertility is being solved out by simple homeopathic medicines
Yes,
without any
absolutely.
procedures, without
Yeah.
undergoing any tough procedures.
Yeah. Yeah. That's true.
Yes, ma'am. So, after all this comes the menopause,
Yeah.
the
Menopause is
end
a
of the stage of this menstrual cycle where all the hormones decline and the ovaries regress and the eggs stop coming out, and finally, the woman enters the phase of menopause. So, it is also a difficult milestone for a woman because there are
yes,
lots
it
of
is.
changes in the body
Yeah.
along with emotional changes and physical changes. Hot flashes are the common symptoms, burning, and then emotional upsets. So, ma'am, tell us about menopause and the cases you have solved out.
Menopause is a huge thing. I mean, there are people who really suffer a lot, but it is less talked about. So I think there should be more awareness about menopause. In menopause, usually it is just taken that the periods are going, so this is going to happen.
Yeah.
So it's not necessary that you suffer in silence. You must take help. That's what I believe. The symptoms usually which come up are commonest is hot flashes, palpitations, and fatigue, mental fatigue as well. You get fogginess. There are temperament changes. You tend to get more irritable at times, and there are lots of mood swings, you can say. And not only that, there is stress incontinence in some cases. The muscles start weaken, so there is generalized fatigue, and there will be sagging of the skin. There will be skin changes, and there are changes in your bones as well. You start getting maybe mild osteoporosis, and all these things are to be taken care of. It's just because of the changes in the hormones that these changes do happen in your body. But I believe if you take care of yourself in that time, you can overcome the menopause and you can stay a healthy and natural life. There is also loss of libido in such cases where female do complain of dryness in the vagina. And yeah, I think that is some there are cases. The cases of fibromyalgia and chronic fatigue syndrome also tend to start around menopause. So many females who suffer from fibromyalgia and chronic fatigue syndrome, those who have had loads of stress in their life, in their previous life, they do tend to get fibromyalgia at this age. But I think it can be taken care of if women seek help. So the commonest remedies which we usually use for menopause, of course, they are constitutional, but the commonest ones we go for are graphitis, pulsatilla, lachesis, millefolium, because some people tend to have loads of bleeding at that time, phosphorus, and calcarea carb, of course, not to mention natramure. These are the commonest remedies. Yeah.
Depending on the symptoms.
Depending on the symptoms, totality. Yes, absolutely, absolutely, yeah. So you need not suffer in silence. You must talk about your menopausal symptoms and you must seek help. That's what I believe.
There are treatments in the conventional system like hormone replacement therapy.
Yes.
And intake of hormones, steroids.
Yeah, HRT.
For this maintenance of the normal hormonal flow and
yeah.
What do you think?
I do have a couple of cases. Yeah. I do have a couple of cases where they were advised HRT, but they did not want to go for it. So they had come to me as for alternative treatment. We started the treatment and they are definitely faring well. So it is basically the indicated remedy, depending on the history, whatever is indicated. Yeah. It does help. It definitely does help. And along with that, of course, homeopathic medicines are to be given, but along with that, I would suggest if the patient is deficient in something, it is important to refill the deficiency. They should take supplements at this moment. And they should take care of the diet as well, of course.
Yeah. Besides this, ma'am, what would you I'm just mumbling. Say, I would like you to say and give some advice on this breast cancer awareness.
Breast cancer awareness.
What have been watching out here?
Yeah. Regarding breast cancer awareness, since this is Breast Cancer Awareness Month going on, the theme of this year, 2021, is RISE, Rally in Supporting, Serving, and Screening Everyone. So what I believe is you should be going for a general screening. What is advised is, it is advised annually to get a mammogram done. But then what I would suggest is you can do at least a basic examination at home, which every woman should do. In that case, what you have to do is, there are a few steps which you need to follow. And to start with, you should just do a general examination, which is advisable usually on the 10th day of your menses, around the 10th day. I mean, some days after you finish your menses, when the breasts are less tender, so you come to know exactly what it is. You need to examine it with the palm of your hand, where you can just see if there is any new lump or any new thing coming up, any new change. If it is there, then it needs to be taken care of. You must see your doctor if there is any new lump which you feel. And if there are some lumps in the armpits, you need to check for those lumps. Okay? If there are lumps in the armpit and a lump in the breast as well, then you need to see your doctor. And to differentiate between other benign lumps and cancerous lumps, usually the lumps which are malignant are more hard and they are immovable, and the skin is thickened or puckered over them. And you will find some dimpling or some thickening or some puckering of the skin, some indentation on the breast, or there could be some flattening of the breast. And along with that, there are some nipple changes as well. If at all during the menopause or after menopause, your nipples tend to become painful, they are scaly, or if there's some itching or some discharge, which is other than milk, then you must see your doctor. It is important. Screening is really, really important. There is a very rare kind of breast cancer, which is called the inflammatory breast cancer. Usually the lumps which are malignant are painless, but this is one type where the whole of your breast is red, swollen, and painful. That is a rare kind, of course. Otherwise, it's usually painless. So if there is any of these symptoms, you must see your doctor. And of course, a mammogram is advisable at least once a year after the age of 40, of course. And it is important that you use a thyroid card when you get your mammogram done so that your thyroid is not affected. So,
Yes.
yeah, it is important to get screened. The more we screen, the more we find it out earlier, and the more we can treat it in a better way. We could provide more help to the patient rather than reaching into the late stage and then
Yes, women should be aware of this, and they should actively take care of this screening or self examination should be mandatory, especially after the age of 40.
Yeah.
And they should, as the motto of 2021, they should accompany with friends or family. They should be more frank and discuss with friends and family, and should voluntarily go and get the screenings done without anxiety. They should come out of anxiety and should take part in all the procedures to better be safe. I'm sorry. So, ma'am,
that's true.
Tell us more about your case. What is your pattern of case study? Did you have any guru or anyone to guide you besides your family and family members?
For me, it was basically my family members and my teachers in general. And as I mentioned, Dr. Devdar, who did provide me with loads of clinical experience. I would like to know about your guru, Sabina. You were mentioning Dr. L.M. Khan, I suppose. I would like to hear about him, please. Yeah.
Yeah, Professor L.M. Khan sir is my guru, and along with him, our whole team of Academy of Quest, they are quite actively teaching a lot of students all over India as well as abroad. We have our regular webinars, and we have our practical teaching at Sir's clinic. So we basically are learning Bengal homeopathy, which is quite famous. The basics of homeopathy in the very simplest form, in the classical form. So it's a great blessing to have him and our group as on our head. The teachings are really very helpful in our practice life. So it's a great blessing for us. Someday you will also come down to meet us and the gurus.
Yeah, definitely.
The legends of homeopathy.
Yeah.
Especially our sir, Dr. L.M. Khan sir. So
yeah, I would look forward to meet him. It would be a great idea to get him live so that we all can...
Yeah, he does come live. I will notify you. He comes live on his own. He has his account in Instagram, L.M. Khan.
Okay.
So you can join him.
Definitely, I will.
On Instagram, and you can see his updates. You can also join his teachings, his live teachings on webinars, weekly webinars and monthly webinars with a definite topic. So it will be very helpful. Basically, he teaches us bedside cases of his along with medicines and the philosophy of organon. So it's been a great boon for the students, because previously they had to attend seminars, go to places, but now since everything is online in the form of webinars, it's easy for everyone to get connected.
Yeah, that's great. I would like to talk about anemia, which is an important symptom which females suffer from, and it is very neglected.
Yeah.
Because females do neglect their diet. They don't take care of themselves as they should. And so there are lots of women who suffer from anemia, and that is the cause of so many menstrual irregularities and disturbances. So I would like to really highlight this, that women should take care of themselves, their diet.
Especially in India, the female are more anemic compared to outside. So
Yeah.
the Indian female does neglect the food and the basic balanced diet which they should take,
Yeah.
and regular checkup and follow up of the symptoms. Also, that is very necessary.
Yes, it is important. Yeah. Yeah. Tell me something about yourself, Dr. Sabina.
What should I say? Know me through Instagram.
Sorry?
Ask me anything if you want. Actually, I have passed out from Calcutta Homeopathic Medical College, which is Asia's first homeopathic college.
Okay, that's great. Yeah.
From where all the legends of homeopathy have passed out of Bengal. So
Okay.
it was a legendary college. After that, after studying and internship, I did house staffship, and since then I'm practicing. I'm continuously in practice, touch with my practice, because it was on and off. There were many circumstances, so sometimes I could not give much time. Sometimes I could give less time, but I was always in touch with my practice.
Okay. Yeah, that's great.
That's the reason I am wherever I am today. But there's still a lot more to do. And it's a great thing to meet doctors like you
Thank you, sir.
all over the globe. So, which is giving me so much more inspiration. And it's good to see doctors all over are practicing homeopathy with great heart,
Yes.
and with basic classical method, with the basics of homeopathy.
Yeah.
So that's it. What should I say? I have a son. I have a 9-year-old son.
Okay.
That's it.
All right.
And I have parents. My father had been quite ill and quite critically ill many times because of his situation. My guru had been quite of help, because we revived him many times with homeopathy.
That's great.
That gave me much confidence. He had the CKD, COPD, but we treated him with the conventional system along with homeopathy, and we have been, touchwood, able to revive him. That's a great thing.
Yeah.
Maybe someday we plan something great in homeopathy.
Yes, we will. Definitely. Yeah. Homeopathy has excellent results in many cases. It's not, we are just talking about female disorders today, but it is very vast. And I must say that I respect all the lines of medicine. Of course, everything has its pros and cons. So, but homeopathy in its place definitely gives excellent results in many cases.
There are limitations. Every pathy has a limitation.
Everything. Yeah, that's true.
We should be able to work in complementary with each other.
Yes, absolutely.
Instead of saying bad about another pathy, we should complement each other. That is the only way to move forward.
Yeah, the integrated approach is the best approach, I believe. Yeah,
definitely. Because there are times when surgery is required, where emergency treatment is required.
Absolutely.
So we have to follow the conventional.
This is where the clinical knowledge comes in. So we need to be thorough with our clinical knowledge, with the diagnosis, where to go in, where to step in, where not to, where to refer a patient if necessary. That is important in a practice if you really want to have a good and safe practice. So you should commit only wherever you are able to help the patient. You must be frank in that. Yeah.
Okay, ma'am.
Okay, thank you so much. It was nice meeting you, Sabina.
It was same here.
Thank you
Great
so
feeling to have
much.
found you on Instagram.
My pleasure.
Hope to meet you sometime soon, face to
Yeah.
face.
Yeah, we will definitely.
Okay.
Okay. Thank you. Take care.
All the
Bye-bye.
best.
Thank you so much. Oh, best wishes to you as well.
Okay, bye.
Okay. Bye-bye.